travel finally because it's quite difficult to combine the different offer of planes to your country, and excuse me, because it's not the it's working well or not. You can hear me or?
Yes, we can hear you very well.
Perfect. Then thank you for my presentation of my career here in this slide. I hear in a lot of voices. I don't know if it's working fine or not.
You can go on. It's perfect here.
Okay, perfect. Then here you have my career, more or less. Today I'm a veterinary consultancy. I perform in my consultancy in different companies in Spain and in America, South America. For example, next week I will travel to Ecuador, and I will travel several countries all around all South America. And I'm a field veterinarian. I'm a veterinarian like the majority of yours, or like yours. My focus is every day visiting farms, so far finishing nurseries, and that's all. Working with pigs and with farmers and trying to solve the health problems, but in our case, not only the health problems. We are involved in personal, in biosecurity, in welfare, because our role here in Spain for a vet it's very big. It's not only as a health veterinarian, as you know probably. In Spain, vets, we are not allowed to sell medicines, and only we are focused in consultancy in the field veterinarian area. In my little company, we are 3 vets and 1 agronomist. Laura is one of my partners, and our activity is advising farmers, advising big groups, pharmaceutical companies, nutrition companies, and the government, in this case, in the eradication programs. I'm one of the persons involved in the eradication program, eradication program for the government. Here you have more or less the small companies that here in Spain. There are a few companies because the majority of them are big integrators, and these big groups, for example, we are advising to companies that has 10,000 sows and 170,000 sows, and consultancy does about genetics, technical support, or training farmers, and so that. And as I said, I am a member of the eradication area for the government, and member of the National Swine Association, and participate in different congresses and and for the swine industry policies. Okay, as I said, my field is a vision field. My vision is a field vision, based in my experience from 1992. I started my career with PRRS. In the first evidence here in Spain is in 1991, and all my career is with PRRS. And then I cannot speak before PRRS. Only the history, or only farms that there are not positive, and the other is based in the science. I'm a very good friend in Cresa. Cresa is the place that Dr. Kim Sagales is working, and a lot of doctors. And the University of Minnesota, I have a friend of mine, Montse Torremorell, is from Catalonia, and she is, as you know, she's a very well professor, very well recognized professor in the University of Minnesota. And the experience shared with all of you, veterinarians like you, from all over the world. I participate in the Ojeski eradication program and in the 2 outbreaks of clinical swine fever. Then I have a wide experience in this disease, and my idea is to share doubts, to explain possible solutions, and after that, if we can discuss with you, I'm very happy to do that. Several slides only for theory. This virus, this PRRS virus, is a has a high genetic variability and continuously is expanding. The capacity of mutation of this virus is incredible high. For I'm discussing with specialist virologists from SARS from the pandemic for human, and they are studying this virus, and they said that the high mutation of this virus for them is crazy, because the RNA polymerase has a mistake every 1,000, 10,000 nucleotides, then increase the replication, and this RNA polymerase has no ability to correct mistake. Then more replication, increase the mutation, and increase the diversity. This is clear and is very well demonstrated. And the other important idea for theory is that if you have more than 2 different variants in the same animals, the possibility of recombination between them is very high. Then this is the first idea with this virus coming from the theory. And today we are speaking about high virulent PRRS strains. And in this paper, Dr. Ruedas explained that for qualificate a high virulent strain, you need to demonstrate that the clinical signs are so high. They define that problems with high mortality more than 20%, prolonged fever more than 40.5, or severe respiratory signs, or with these lesions, severe intestinal pneumonia, thymus atrophy, petechia, the viral load, the number of PRRS cells in the blood, and the pro-inflammatory cytokine cascade is so high. This all situation define the difference between high virulent strains or only virulent strains. And today, in our situation here in Spain, we are having the last outbreaks with high virulent strains. The most famous today for you is Rosalia, but before Rosalia, we suffer other high virulence strains like Bisbal, and before that the name we used was fast like, and it's not new Rosalia, but the situation of Rosalia is new because Rosalia moved all the rest of the high virulence strains. Only one explanation for these kinds of names for the strains. We used these names several years ago. A group of veterinarians here in Lleida, they decided to use these names, only joking, using, for example, if this singer goes to a lot of concerts and has success, those we use this kind of simile to use these names and change the name. Instead of use the lab or the scientific name, we use this name most common and most easy for farmers and for vets. Probably today we need to, it's not a good idea or not, I don't know. But this is the explanation of we use these names. The history of high virulence strains of PRRS is not new. You have this map from this the same article from Dr. Ruedas, and you have Lena in the east of Europe. We have PR40 is from Italy. PR40 is very important because it's involved in this Rosalia strain. And you know the Chinese high virulence strain. I visited China several years ago, and they are having a very high outbreaks of PRRS. And as you know perfectly, in the United States, the strain 1744 is the last strain, but before that, they had another outbreak of this strain. It's not new. It's a question of mutation and recombination, and probably it's a question of time to suffer this kind of strain. Okay, the origin of Rosalia in Spain is explained for Dr. Enrique Mateu from CRESA, from this center of investigation in Barcelona, University of Barcelona, is a combination of different strains. The majority of the genome of this virus is from this Italian variant, PRRS-40, that is described in 2014. And coming to Girona, to this area, probably the majority of you know Girona, you know the Costa Brava. In this area, there are very good beaches, but there are pigs too, and probably arrive when importation of piglets. And there are a very few fraction of a Korean variant. Surprising, it's incredible. Why a Korean variant in this combination? And the first PRRS-40 in Italy, for this strain, they had a very high pathogenic problems in Italy, as we know. And after that, New Rosalia, because had a combination with another strain of Spain from this area. Then here you have the virus with the pink color. You have the part of Rosalia, the majority, the PRRS-40 from Italy. Then, as you can see, the majority of the virus is from Italy. The blue color is from local Spanish isolate. The clustering here, you have the name, KC86. If you want more information, is from Olot, from a city of Girona. And after that, you have the Korean clustering, and there are a little segment. There are no origin. We don't have any information. This is the virus, the total virus. Today we have the capacity, as you know, of 100 sequencing of the virus, and here you have. And this coming from the University of Barcelona, from Dr. Martín Valls, that they described it in 2022. And here is more or less the evolution from Dr. Enrique Mateu, explained perfectly, in more or less probably in the week 5, 2020, arrived. The history more or less is that this strain arrived with an importation of piglets from Italy. It's not common to import piglets from Italy, but you know probably the commerce of Spain. Spain is open to receive a lot of piglets from all around, from all Europe, and in this case, arrived piglets from Italy. And I don't know why, but these piglets has this combination of this strain with Olot strain move this new strain. Probably the idea of Dr. Mateu is this strain PRRS-40 is working before this first report. Probably this is the history, and after that, move the virus during the autumn of 2020, winter 2021. This is a very important road. Is the pig road, because here is the most crowded area in pig production is Lleida and the surroundings of Lleida. This is Vic, is the center of Catalonia, and this is Girona. And here we have the pigs, and here we have the slaughterhouses in these two areas. Then this road is the road of piglets, and they move probably companies located in this area and has finishers in this area, or nurseries, or everything, probably move the virus. And after that, when arrived Lleida, as you know, has them probably the more bigger companies in Spain, a very big integrator, and all of that move the pigs and the strain all around Spain. But there are special situations. For example, in this area near to Madrid, in Segovia, In Segovia is not located this virus. Probably is because this area work as a closed cycle. They produce his own piglets, they grow his own piglets in this area, and they only move piglets to the slaughterhouse. And probably, okay, this area is a special area. Murcia has a very important production, and they move the Rosalia to this area. And there are no evidence in the south of Spain, and in the Iberian area of Spain there are no evidence on this strain. Then more or less here you have the evolution, and today in 2023 we are isolate the virus. For example, last May, June, I isolate the virus before the summer condition. There are a lot of recirculation of this virus. Today in this area is Tauste, and in the Zaragoza area there are a very big production area. There are a very important outbreaks today at this moment. Okay. The factor for the dissemination of this high viral strain, there are 4 factors. The majority of them has a very high viral load. There are more longer excretion. We have this is a special for this kind of virus, and Spain has 2 more important items that probably you know, but I need to explain to you. We have a lot of national movement of piglets because our system of production, and we import a lot of live piglets. And here in the next slides, I will explain you more or less. Remember, when we are performing a lot of PCRs in blood, but if you move a easy number when you have a CT of 20 or 15 in the blood of the animals, you need to know that the 15 in the blood of animal probably is 10 millions of virus in this circulation inside of this animal. You have 20, you have 10,000 to 1 million, and that's all. Today, for example, with this kind of virus, with Rosalia isolate, it's easy to obtain, for example, in one abortion of one sow, it's easy to have 17 or 18 for CT. Then remember this number and how many virus these animals are shedding to the environment, how many virus they are shedding with blood and something like that. Okay, longer excretion times. We are in the past with the common viral common strains of PRRS. We have experience during 4 to 6 weeks. There are excretion of this virus, but with Rosalia or Bisbal or this kind of virus, the excretion could be 10 to 12 weeks, and it's normal. For example, we need more than 20 weeks in a sow farm to recover the production and to stop the PCRs in piglets, as I explained you after. And special for Spain. Spain, as you know, has the integration. We are using the integration system. We have a very big farms, and the majority of these farms, they are producing in the 3-site system. Then we are moving piglets from the sow farm to the site 2, and after that to the finishers. And it's common that, for example, one piglet was born in my village. Here in my village, we have a lot of farms, and they born here and they move, for example, to to Zaragoza, and after that they move to the same province, but come on to for finisher to Girona or to South. This is common. This kind of movements of piglets in Spain with this kind of system of 3-site production. It's very common, and then this system has very good solutions, but has a very bad solution instead of shedding virus to the environment. And the third one, we are import a lot of live pigs. Here you have, for example, a proportion of this is Spanish, excuse me, but it's information from a regional lab here in Lleida, a lab that gives a lot of information about the health, about a lot of they took a lot of blood samples and to try to explain the the situation, the epidemiology of our area, and they are looking from the majority of the imported pigs, and here you have the name in Spanish is easy for you: Belgium, Denmark, and Holland, and the number of batches that they analyze, and then the percent of viremic batches of this from Holland. We are receiving from 76 batches. The majority of them, they are positive, the same as Belgium, less in Denmark. And here you have for example, that there are from 154 batches, 92 of them there are positive, 70 of them. And here you have the sequencing of 5. And here this is 10 coming from Holland for sure, because they're only detected in pigs coming from Holland. I don't know the origin, because the majority of the traders here in Spain, they buy the piglets not directly from a sow farm. They buy, as you know, from these combination centers, and probably they mix a lot of origins, and that's all. But it's not your fault. It's not the Holland fault. It's our fault. It's our problem. I'm not saying, but it's I'm trying to explain the situation, because you can understand how, because we are having this outbreak, and if this could be a lesson for you, try to understand that how the things are not working well. Probably for me it's okay. No, the current situation today in Spain, speaking about how PRS is impact in the health. For example, here you have the SIP Consultors information. SIP Consultor is a company that they are sharing the cost of production and the number of production of a lot of companies. It's a private company, and you need to pay for this service. But they shared, anonymous for sure, the information, and they had more or less an average of the number of productions in our country. Here you have. From 2006 to 2022, the pigs winning for South. Here you can see that we are increasing to 2020, and last 2 years they are reducing. Today, the last information from the first 6 months of the 22-3, it's more or less the same, 21-1. But here you can see that the mortality inside 2 and inside 3, it's increasing in these two, and especially in side 2, in the nursery. The majority of these cases are due to PRS and due to zinc oxide for bite for the last year, and antibiotics reduction or prudent use of that. But the majority of them are from PRS. Why? Because when you have an outbreak in the sow farm, you are sending a very poor or a very bad piglets to the nursery. Speaking about the health in the side 1, in the majority of the cases, we increase the abortions. Probably the average in a farm is 2.5 when the farm is working well. You have an outbreak of Rosalia, you increase to the double, more or less, 4.2. There are several weeks that arrive, for example, at 15 or 20. Abortions is one of the most common health effect for this PRS strain. Increase the mortality in the farrowing crates between 13.5 to 15. I'm speaking in average. There are in several farms could be arrived to 25, 30 because scores, because a very poor calostration, because there are the piglets are suffering a lot, increasing stillbirths, increasing mummies, and excuse me, I forgot to put the increasing the mortality of sows. One of the problems with these strains, as they are they are killing sows, more or less between the before farrowing. It could be in the middle or in the most acute moment of the outbreak. The mortality of sows could increase to the double. For example, if you have an average to 12% of mortality, could be arrived to 20 or 25% of mortality in several weeks. And after that, recover, but we need unless 20 weeks to recover the production pre-outbreak data. And this is very, very common with this outbreak. For the moral of the farmers, the moral of the farmers is related with their income. Today, the income of the farmers in Spain is very good, because they are having a very good prices in the meat market, but Rosalia in several farms causes a very difference between farms. For example, if you have 20 farms, if you have only 2 outbreaks of Rosalia in these 2 farms, you are losing a lot of money, but in the other 18, you are earning a lot of money. This is a crazy situation for the few people that they have only 1 farm. And this is the problem for that. For the rest of integrator, well, they are moving. They try to solve the problem, but it's not the worst situation in our history. For example, when we had a very high price of raw material, it's worse that today with this kind of problems. The pig sector is too strong, and it's growing in this period too. And for us, it's a new opportunity to learn, because it's not easy to manage. We have to learn a lot about how to manage it, because it's not easy, as I explain you in the next slide. It's a very good opportunity for that. You know perfectly that there are a few reduction of the sows and the pig sector in the whole Europe, and probably only Spain is the only country that is increasing. Then for this situation not only for PRS, for this situation is good, because the demand of pigs is so high, and we can sell all of it. More or less, speaking about the economic impact of with an outbreak, if you have a loss of 1 piglet per year, if you have a low price of raw material, the impact could be 2.3 euros per sow, per piglet, excuse me. And if you have a very high price of raw material, 2.7. Here you have in this slide. If you have an impact degree medium, 1.8 piglets, the impact was 4, and the impact was 4.8 for a high price of raw materials. And if you have a high impact today, probably is more common the high impact than low, for sure, medium or high impact. 2.5 piglets, it's normal that you lose during the outbreak, not during the outbreak. If you analyze 1 year without Rosalia and 1 year with Rosalia, probably the loss could be 2.5 piglets in this farm. And then the impacts you have here for 5.7 euros and 6 euros if you have a high price of feed or raw materials. Okay, and we are in the last slides. How we diagnose and how we manage it probably is the most practical slide for you, and try to share this information. First of all, we are using tongues as a system to diagnose the PRS, the situation of PRS. We pick up the tongues from stillbirth every week, and we place in a bags, well identified, and we can separate gills from sows. It's easy for the farmers to cut the tongue and to put in this, and they frozen. They store in the sample in the freezer. When the beds arrive to the farm, for example, every 4 weeks, if you defrost this liquid, we send to the lab, and in the lab they obtain the dryness fluid, and they perform a PCR from this fluid. And here, if it's necessary, if the PCR is positive, we can sequencing the PRRS. And doing that, we know perfectly how the outbreak is managed, how the outbreak is moving, or if the farm continues negative or is not reducing the shedding. And then we, with this information, we can move to the farm and recommend several management solutions, as I explained you after. In this case, every batch we take tongues and perform PCR against PRRS. We organize it in pools, as I said, gills versus sows. The cost for every PCR in Spain in this lab is 25 euros per PCR. And if the PCR is positive, then we order sequencing to know if we have a new strain, a lateral infection or not. Is the same strain that is moving inside of the farm, and try to, or for example, if they are several recombination, and the cost for the every sequencing today is in the slide is I wrote 200 euros, but the last price probably is 150, 140. We can obtain a sequencing or 5, not the whole sequencing of the virus. This is more. And here you have, for example, a combination. This is from article from this lab. JSP is the lab I explained you before, and it's one of the places that we are, the majority of the beds, we are sending blood samples and tongues and ropes to this lab here in Lleida, but they receive from several parts of the country, not only from Catalonia. They receive from Aragon, from the majority of the PRRS. And here you have combinations and between processing fluids versus tongues in a farm. When you have this circle in this position is negative, and here you have the CT. You have here, you have the CT of 26. And you have here, you have the CT of 20. In this farm, they are using processing fluids from castration and from the cut of tails. And we introduce the tongues, and with the tongues, we can see that one part that you are thinking that is negative, is reducing the shedding of virus. Using tongues, we demonstrate that the reduction is not okay, because there are more excretion that the tail or the processing fluids can demonstrate. Then, for this reason, we are using this system to demonstrate. For example, in this farm, it's an explanation. This farm infected in last November 2022. It's one of my customers, and today we have 20 weeks with negative tongues in the farrowing crates. Then we can decide to, for example, to introduce gills or everything that you need, because the farm is moving to a negative or more than a stable farm. Speaking about PRRS. Okay. One of our lessons, one of the ideas of this disease in Spain, as The biosecurity and the biocontainment of an immunity is very important, but the first two steps, biosecurity and biocontainment, probably is the most important items to fight against this disease, because we have cleared today that the virus arrived to the door of the farm, and the workers, the personnel outside, plumbers or electricity or any of the trucks, they move inside to the farm. This is the idea. It's not moving by airborne transmission. We have cleared, if they move with airborne transmission, the majority of the farms in Spain are positive, was positive, and it's not. Then, for example, here you have an explanation. This is a little village, not a little village, but it's a village with a very few population. If you compare with the pigs, every dot you have in the screen is a farm. A triangle is a sow farm. A square is a side 2 farm, and circle is a finisher. And in this area, here they can use water better than in these areas. You look in the map. The name of this village is Alcarràs. Alcarràs is one of the villages in Lleida that has more high density, big population, and you can see positive farm with red color are positive farm in the high density area, but you can see positive farm in the less high density area. If you have airborne transmission, all these farms could be positive, because the nearest between these farms probably is in several cases is 1 kilometer or less than 1 kilometer. And there are negative farms in this area and in this crowded area. For this reason, we have cleared that the virus arrived to the door of the farm, and the workers or everybody moved to inside. Another important item, another lesson for you, it's there are more possibility to have an outbreak of Rosalia if you have a big farm instead of a few farms. The majority of the farm, the average of the farms in Spain is 1,000 sows today. 1,200 sows is the average that the government set. And here you have, and probably is because these farms has more movements, more incidents of trucks coming inside, or trucks coming, or movement of slurry, or movement of people, or something like that. But and believe me, these farms are more new, probably are in better condition of biosecurity, but they have more possibility to this movement. Another important problem that we learned in Spain is that the destruction of the pigs. I don't know in Holland how we perform that, but collecting between farms, it's a very well transmission system for this virus. The majority of the farms in Spain, probably in the I don't know if you can see in proper, but you have here the photo of a farm. This photo is from yesterday. It's a very well designed system to move the piglets, but the truck arrive here. If you are not doing a well biosecurity, probably you can introduce the virus because blood or because flies or because birds. And today, the majority of the farm, the big farm, they are moving to hydrolysis. This is this kind of containers. These big bag containers arrive one truck here, and they recover 3 when they are full, and they move to the special plant. But the truck only arrive to this farm. Not it's the same system than this system that one truck is moving between farms. And the last one is incineration. Is not forbidden in the whole. Is not allowed. In the whole country. Only several provinces can do that. But if you use incineration, we need to combine with hydrolysis, because it's very useful for sows or for big animals, but it's not useful for piglets or little piglets or several, because there are a very high humidity and the system is not working well. But believe me, we demonstrate that between 2 farms that with 80 kilometers of distance, without any relation with 2 companies different, They had the same strain, and believe me, probably the peak is the transmission of this virus. Gestion of storage is another important item, but today we are not, probably is not the most important. Professional people that goes inside the farm without any control of biosecurity, plumbers, electrician, it's another. They for example, introduce any machine or any today in the important farm with a high biosecurity, they had a special place to introduce this kind of material, and they or medicines or other material, and they use ozone to try to avoid the infection of the virus. We are increasing the number of system for cleaning trucks. Here is an example of another important client of my company, Singapore. It's a company has today has 60,000 sows in between Aragon and Catalonia, and they built a new important system to clean and disinfect his trucks. And speaking for the last part of my presentation, immunity. If we speak about Aujeski, we have clear that immunity is better than biosecurity. If we are speak about PCV2, immunity is better than biosecurity. If we are speak about African swine fever, biosecurity is more important than immunity because there are no vaccines and probably, but I don't know, I have an open discussion with you. PRS, for me, vaccines are help for sure, but it's not the only. Then it's need a combination, and probably in this case, biosecurity needs more importance in this balance than immunity, because in our experience with these high virulent strains, there are no power the common vaccines. As I know, there are several labs, for example, MSD is working with Rosalia. Next week, they explain us new information about that. But it's not only a question of vaccines for to try to solve this problem. And for a control on outbreak, and this is the last slide. We need the first idea when you had an outbreak is to try to stop the circulation as soon as possible. During the circulation, our recommendation during the circulation is stop vaccination. The majority of our farm, we are vaccinated against PRRS 3 times per year, all the sows, mass vaccination. If you have an outbreak, if you have in your schedule, you need to vaccinate at this moment, we stop because we are afraid about the combination. Stop the introducing of gills during the outbreak if it's possible, not introduce McRebel is the best technique as strict as possible. Believe me, it's very useful. Diagnosis, the solution of tongues is very, and today the new item we are introducing is looking for a resilient animals. We have a very good experience with different genetics, a bad experience with others. And we have cleared that there are animals that are more resilient than others, speaking about PRS. We are introducing in the majority of the cases in these big farms, or not only in the big farm. We start in little farm, but we are moving to big farm. There are farms with 3,000 sows that they are moving with the batch 5-week management, and it's very useful. And there are a new option that it combines 5 weeks management with 3.2 management. In other occasion, I will explain, because if not, I don't have enough time. But it's very useful to obtain a very all in, all out inside of the farm to try to reduce the shedding of the virus as soon as possible. And today, the incidence of this high virulence strain has increased in the recent years. I don't know why. Probably it's because we are moving more piglets. I don't know why, but this is the true idea. The damage of these strains are greater for sure. We are determining different risk factors. We have cleared that the movement of the piglets, the biosecurity outside of the farm, inside of the farm is very important. For the reason this strain is controllable, but we need to improve the strict effort of high biosecurity. But our concern today is African swine fever. Here you have this is my last slide. Here you have the map, you know perfectly. I know that Holland is free of African swine fever. This is the most important probably problem of our worst concern today for the pig business in Spain. And that's all. Here you have a photo of the production of our incredible pigs, ham, loin, fouet, chorizo. And when you visit Spain, I will show you the different combination and we can do with the pigs. And it's my pleasure to explain this morning for you, and I'm open to the questions. Thank you very much.
So thank you, Alberto, for this excellent presentation. Does someone in the audience has questions for Alberto?
The main route for infection in the Netherlands is artificial insemination.
Maar is gestopt met rooien.
I didn't hear it in your presentation.
Ja.
You are asking about if artificial insemination is a problem for us or not?
Yeah.
Yeah, it's not a problem, not with this Rosalie strain, but it's a very good question because probably one of the high virulence strains that I explained you before, the name is Bisbal, move with artificial insemination for sure, because at the same date we have the strain in Catalonia, for example, in Andalusia, 1,000 kilometers, and it's only the only possibility to move this strain is with a road inside of a car. But today in Spain, because this experience, never we can demonstrate that. But all the evidence is that the artificial insemination is moving the strain. Today, the big centers needs to demonstrate every day that they are performing PCRs in the boars and PCRs in the semen, and all the customers receive all the information about the cleaning situation of the boar staff in Spain. And at this moment, we solve this situation. But it's a very good question because in the past was an important transmission. Never we can demonstrate because the boar staff said that if you don't have the bottle with the virus, you can demonstrate that I am the problem. And this is more or less the situation. Thank you for the question. Very good question.
Maybe we have time for one more question.
Thank you for your presentation. One of your measurements was to apply a bird closure combined with stop of vaccination, if I understood it right. How long is the herd closure? How long is the period you don't apply to bring in new gills? And is there a difference between sow herds without green piglets or multi-site production or where green piglets are on site?
If I can hear the question, I cannot hear perfectly, but if I understand properly, how many times the farm is closed and what kind of animal introduced when we open the farm? This is the question?
Yeah, how long is the herd closure?
Yeah, how long? 6 months, not less than 6 months. And when we finish, we try to introduce sentinels animals between 40 to 60 kilograms from the genetic that the customer decided to introduce. And after a quarantine period, we demonstrate that the animals are negative. We move between the farm, and if we demonstrate that there are no infection, we are having the information of the tongues every week. We are sending to the lab the tongues, and when we have 15 weeks with tongues negative, we introduce the animals. But believe me, before these 15 weeks, probably you have 15 weeks more with positive tongues. Then more or less between 6 months to 30 to 30 weeks and after that, sentinels animals to demonstrate that the farm is stop shedding, and we can introduce animals as quick as possible and as the capacity of the farm has.
In that period, do you apply MLV vaccines? First vaccination on the south.
Yes. In that period, when we finish when for example, when the outbreak is finished, there for us outbreak is abortions, stillbirth increasing. When the outbreak stops, we introduce again the vaccination, the mass vaccination against PRRS. Yes.
And that's normally a modified live virus vaccine.
Live vaccine. We are using live vaccine in the majority of the cases. Yeah. There are several. This is a question of a vet. Here, probably in Spain, there are the majority of the vets we are using live vaccine, but there are several teams that they are combining live with kill vaccine. In several occasions, I perform that to try to improve, but I don't see any better results than only using live vaccines.
Thank you very much.
So thank you again, Alberto, and thank you for the questions. Would you stay on the line a little bit longer, please?
Thank you.